Hello, good morning. Good morning.
Good morning, sir.
Good morning, Sunil. In last class, up to which aphorism we have discussed? Can anyone tell me?
160, sir.
160. Completed.
Yes, sir. Aphorism completed, but footnotes remain.
Okay. Okay. Footnote is actually an increased eruption of sulfur. Okay. That is for aggravation. The few examples of aggravation in old school have been given. Okay. That may be important for your MCQ examination, MCQ purpose. Okay, so just remember those examples. We will skip that. Uh, remember those examples for MCQ examination. It will be important. Sometime people ask MCQ based on this, that facial eruption was aggravated with viola tricolor, in which aphorism Hahnemann have mentioned aggravation in the old school. Okay. We have discussed during our discussion on introduction that they have discovered homeopathic medicines in old school. Older physicians have discovered homeopathic medicine, but they were afraid of using it because of what? Because of this homeopathic aggravation. And still you will get medicines of malaria. You will get written caution there. This may aggravate your fever or your rigor. Okay, contact immediately. In some patches of that malaria drug, you will be getting this caution that it may aggravate your rigor, or it may aggravate your fever. To contact your doctor immediately, like that. So there are some specific medicines they have discovered before, and they were audible. Okay, the time to time there will be some call, and I may not be audible. So at last, Hahnemann have also found this homeopathic aggravation in the year 1897 with Veratrum album. Am I correct? 1897 though.
1797.
Sorry, 1797. Okay, I was just checking that if you people are remembering those facts or not. 1797. With Veratrum album, he got aggravation in his patient, and from that period onward, he was going to smaller doses, and finally we are getting 1843. In 1843, we are getting uh, the this LM potency, development of LM potency. So these kind of stumbling block with we have discussed with chronic diseases, and we have discussed with this homeopathic aggravation. Today we will start from 161. 161. We have referred this aphorism many times before regarding rapidity of cure, what the rapidity of cure actually means. Okay, so please, one of you please read it. Actually, it is we have referred that aphorism. This is 149 to rapidity of cure. This aphorism is regarding you people sometime ask, no, when there will be action of medicine, or when there will be aggravation, you will observe. So this is homeopathic aggravation, time taken for aggravation in acute and chronic diseases. One of you please read it.
Okay, sir. When I hear limit the so-called homeopathic aggravation, or rather the primary action of homeopathic medicine, that seems to increase somewhat the symptoms of the original disease to the first or few first hour. This is certainly true with respect.
Underline first or few first hour. You are not audible, Sunil, anymore. First or few first hours. Underline that and underline acute.
Sir, am I
Sunil,
audible?
okay, hi, you are audible. Underline first or first few hour, then acute. Then acute.
Sir, am I audible?
Yes, yes, you are audible. You are audible.
Oh, okay, sir.
First few hour, underline that and then underline acute character. Then underline acute character. Okay?
Okay.
Okay? Next.
This is certainly true with respect to diseases of a more acute character and of recent origin, but where medicines of long action have to combat a malady of considerable or of very long standing.
Underline this.
Where one dose consequently must continue to act for many days, we then occasionally see during the first 6, 8, or 10 days the occurrence of
Underline this.
some such.
Underline this. In common practice, we usually give our patient for chronic diseases medicines for 2 weeks. This is our common practice. That we ask patient to come after 2 weeks. This is habit I have cultivated since the time of NIH, because in NIH we used to prescribe LM potency, and LM potency, all we know that in NIH 16 doses are prescribed at once. We have discussed this NIH method some in previous some classes. I think people are objecting that, but this is helpful for the beginners. So 2 week, at least 2 week is necessary to judge the progress of a patient in a chronic disease. Okay, first 6 to 8 and 10 days are being taken to medicine to get effect on. Okay, so before past 6, 8, 10 days, you won't get any homeopathic aggravation in chronic diseases usually. Okay, next. Next, read next. Okay, I think Sunil is unable to connect with us.
Sorry, sir. Mic mute.
Okay.
Okay. So the occurrence of some such primary action of medicine, some such apparent increase of symptoms of the original disease lasting for 1 or several hours, while in the intervening hours, amelioration of the whole malady is perceptible. After the lapse of these few days, the amelioration resulting from such primary action of the medicine proceeds almost uninterruptedly for several days longer.
Okay. After the lapse of few days, the amelioration resulting. Amelioration. Okay. So what is Kent's observations? First observation, second, in Kent's observation, there are either aggravation or amelioration, or few different things are there. Okay, so Kent's observation is actually have been derived from these writings of Hahnemann. Okay, Kent's observation is nothing means original contribution. You cannot tell this is an original contribution of Kent's. Hering's law derived from the writings of Hahnemann and Paracelsus and Hippocrates. These are not the original contribution of Kent or Hering, but what they have then done, they have systemized this. for easier understanding of students. They have systemized it, and we can understand easily from their observation. Okay, so read the footnote. 161 has got a single footnote. Read it.
If the action of those medicines to which the longest duration of action is proper quickly expires in acute diseases, most quickly in those that
Underline
are
this.
most
Underline this. Longer durations medicines are expiring quickly. Okay. Okay. Too short relief of the symptom. What is it? Which observation it is? Too short relief of the symptom.
sixth observation.
Yes, sixth observation. And what is your interpretation? What is your interpretation?
Partial similar medicine, it may be partial similar medicine.
And not partial. Actually, if the disease is acute, in sixth observation, if the disease is acute, you have to repeat. That is here. Okay. And other was the disease is incurable.
Yes,
Okay.
sir.
The other was the disease is incurable. That is why the medicine is not going into depth. And other, you can say the potency was not correct. Potency need to dose need to be somewhat deeper. Okay. But remember, in acute diseases, even the lycopodium which used to work for months together will expire suddenly. Lycopodium and acute disease, can you suggest uh, mm, any acute disease where lycopodium is frequently indicated? Any acute diseases where lycopodium is frequently indicated? Go to Allen's. Go to. We are actually deviating from the topic. Just coming into mind, we are clinically oriented. These are clinically oriented discussion. So whatever coming into mind related to clinic, I will share. So lycopodium in acute diseases. Go to Allen's keynote. There are many symptoms for acute diseases you will get, but you will get one symptom. Maltreated pneumonia. Got it? Means pneumonia neglected or maltreated. Okay. Base of right lung involved especially to hasten absorption or expectoration. This line is actually you will get in like a few of symptom until in last class I have shared actually from one of my patient of calcaria was improving under this. Few not one, few of my patient are improving, and at that time when I have shared this in group, this symptomatology usually in climacteric women. So that was from my clinic, that these patients of menorrhagia at climacteric, they are being improving under this medicine. Okay, so like this pneumonia of this thing I have got in children. Okay, in 1 month child of 1 month, child of 2 months, they are having pneumonia. Along with this, you can write in the margin, along with this, if you are observing your patient clearly, you will get dilatation and this of nostrils, of the wings of this will flip flop. This will this nose nostrils will be flip flopping. Okay, like this. So when these are active in a child, when these are active, when there is some breathing distress, accessory muscles, these are the accessory muscles of respiration, wings of nose, this sternocleidomastoid. Okay, all the accessory symptoms, all the accessory muscles of respiration will be activated in shortness of breath if the patient is having breathing distress. So in child, you will be easily observing dilatation and constriction of this wings of nose, nostrils. That is there in Lycopodium. That is there in Antium tart. Okay, open Antium tart. Spasmodic relation in relationship. Spasmodic motion of ala is replaced by dilated nostrils. Lycopodium, in Lycopodium there was constriction and dilatation, spasmodic motion, but in Antium tart there will be dilatation only. Okay, there will be dilatation only, replaced by dilated nostrils. That is Antium tart. When Antium tart is given, when there is rattling in chest. Okay, often you will get ipecac and Antium tart indicated in those kind of children. Ipecac and Antium tart. Okay, and this pneumonia of Lycopodium. So Lycopodium, if the Lycopodium, you have given Lycopodium, return to the original topic, you have given Lycopodium 200, you cannot expect in these kind of pneumonia Lycopodium to work for days, for months. No, this is not the case. Okay? In acute diseases, where the pace of disease is quick, the medicine will expire quickly. Got it?
Yes, sir.
Okay. Now, read next.
Okay. So expire in acute disease most quickly in those that are most acute. It is proportionately long lasting in chronic diseases of psoric origin, and hence it happens that the antisoric medicine often do not show any such homeopathic aggravation in the first hour, while they do show later and during various hours for the first 8 or 10 days.
Okay. Acha, why this footnote have been removed in 6th edition? Any idea?
Maybe due to introduction of LM potency.
Yes, maybe not. This is the reason. In LM potency, whole concept of homeopathic aggravation have been changed. No.
Yes,
So,
sir.
so proportionately long lasting in chronic disease. Proportional. Okay. We have taken this idea for rapidity of cure. Cure will be rapid in proportion to this. So medicine's action will be lasting proportionately to the duration of disease, to the pace of disease. So in chronic disease, you will expect this Lycopodium to work for 2 months or 3 months together. Okay. In chronic disease, you will expect CPR to work for months together. But if it is not working for months, like CPR case I have shared in the group, that in a boy, the symptomatology of CPR was present. Offensiveness of urine, the enuresis at first sleep, aversion to milk, desire for sour. These symptomatology of sepia was indicating sepia, but sepia was not holding the case. Okay, and finally I have to give teucrium on the basis of our this worm theory, and again I will give sepia. After teucrium finish it works with the removal of blockage of that worms, again I will give sepia and will let you know the result, how far the CPI is going to hold the case. Okay, so never doubt your medicines. If your medicines are not holding, search out why this is not holding. Okay, search out the things. If the disease is acute, it is obviously that the medicine will act finishes its action quickly. Clear? Now this 6th edition, read this part from the 6th edition. From here onward, the 6th edition, whole paragraph have been changed. Now read this.
Okay. Where no such apparent increase of the original disease ought to appear during treatment, and it does not so appear if the accurately chosen medicine was given in proper small, gradually higher doses, each somewhat modified with renewed dynamization. Such increase of original symptom of a chronic disease can appear only at the end of treatment when the cure is almost or quite finished.
Okay, so this is the concept of aggravation in LM potency. there will be no such aggravation, and why there is aggravation at end? Why there is aggravation at end in LM potency? Any idea you get?
Late I think this is the late appearing symptoms according to Herring.
No, that is a completely different thing. Late appearing symptom is completely different thing. Any idea why this is at last? Not in the beginning. And if there is aggravation in beginning, what will be your interpretation? If there is aggravation in the beginning, what will be your interpretation? Any idea? I have given LM potency and patient is aggravated. What will be your interpretation? Anyone? You know beforehand. Those who are in third BHMS, they might not know because they have not studied this. But those who are in fourth BHMS or higher classes, they must know.
So aggravation depends on the susceptibility of the patient. When the susceptibility of the patient or the dose is higher, so it may get aggravated.
Not actually that. I'm searching the aphorism for you. Wait. If there is aggravation, my two questions are there. If there is aggravation in the beginning, okay, what is your interpretation? And if there is aggravation at the end, why? Why there is aggravation at the end?
Sir, if it is in the beginning, then it may be because of frequent repetition of the doses.
Not frequent. If it is in the beginning, let me search the aphorism for you. I am forgetting the aphorism where it has been. It will be easier for us to understand. It will be easier for us to understand where there is a word no longer medicines are needed, like that. In 273 or 4, like, but I'm not getting one. 281, 88, where it is. Okay. Okay. Now read 280, 6th edition.
280, sir.
280, 6th edition.
The dose of medicine that continues serviceable without producing new troublesome symptoms is to be continued while gradually ascending so long as the patient with general improvement begins to feel in a mild degree the return of one or several old original complaints.
Stop here. One sentence have finished here. So stop here. First of all, keep in mind this is regarding 6th edition. So किसकी बात हो रही है? LM potency की बात हो रही है. Okay, that have to be given in gradually ascending. Gradually ascending. What is gradually ascending? 0/1 भी दे रहे हैं. We are giving in 16 dose bottle, na? Like this. 100 ml bottle, 16 dose. And what is gradually ascending? Each time you are asking your patient to give it 10 succussion. Give it 10 succussion. Each time this is gradually ascending. Then there are things where we ask our patient to increase the cup. We will discuss that. So in gradually ascending, up to which period we are giving? Up to which period we are giving? There is the return of one or several old complaints. Now this indicates what? Pardon.
Next, sir.
This indicates
Homeopathic aggravation.
हाँ, this
अच्छा,
indicates यहाँ पे
it
इसी में
indicates that the vital principle no longer needs to be affected by the similar medicinal disease in order
this
to,
this indicates an approaching cure. वहां से
sorry. This indicates an approaching cure through a gradual ascending of the moderate dosage modified each time by succussion. It
okay,
indicates
underline this. This indicates, just underline this indicate, then again it indicate what? It indicate what? Again, number 2.
it indicates that the vital principle no longer need to be affected by the similar medicinal disease in order to lose the sensation of natural diseases.
Okay, next it indicates number 3.
It indicates that the life principle now free from the natural disease begins to suffer only something of medicinal disease hitherto known as homeopathic aggravation.
Okay, at last this medicinal disease have come because there were doses were so small in the beginning that homeopathic aggravation was not perceptible. Okay, now the natural disease have been replaced slowly and gradually by this medicinal disease. Natural disease is totally not there, but this medicinal disease is going, and there is no need of any medicine. It is showing by that medicinal diseases symptoms are coming. What these symptoms are actually of? These symptoms are of medicinal diseases. Okay, this is actually why the homeopathic aggravation is at the end, because there is no natural disease to neutralize by medicinal disease. So medicinal disease is lying there alone, and the aggravation is seen at the end of the cure in LM potency. Okay, clear?
Yes, sir.
At the end of homeopathic cure in LM potency, at the end, what you are getting? You are getting actually the medicinal disease. Why you are getting? Because there is no natural disease present, so medicinal symptoms is not being neutralized or is manifested at last. Okay.
Yes,
So
sir.
these 3 points are often asked in your examination, that what it indicates. Okay, in interview people will ask you what it indicates and why there is aggravation at the end of LM potency. So with due reference with aphorism number 280, you have to put these 3 points. Okay, so and why there is aggravation in the beginning? If there is an aggravation in the beginning of LM potency, what you have to do and what that indicates? If there is aggravation in the beginning, what that indicate? Go to aphorism number 248, footnote 6th edition. 6th edition footnote. 248, footnote 6th edition. Third sentence.
So, sir, the
From second
solution.
sentence. The solution from that solution. Pardon.
The solution of medicinal globules, and it is rarely necessary to. The solution of medicinal globules of a thoroughly potentized medicine in a large quantity of water can be obviated by making a solution in only 7 to 8 tablespoonfuls of water, and after thorough suction of the vial, take from it 1 tablespoonful and put it in a glass of water containing about 7 to 8 spoonfuls. this stirred thoroughly and then give a dose to the patient. If he is unusually excited and sensitive, a teaspoonful of this solution may be put in a second glass of water, thoroughly stirred, and teaspoonful dosage or more be given. There are patients of so great sensitiveness that a third or fourth glass, similarly prepared, may be necessary. Each such prepared glass
Wait
must
here.
be made
Wait here.
fresh daily.
Wait here. That is what we are asking our patient who are complaining of aggravation from the very first dose. Okay. Why they are complaining? Because they are unusually excited and sensitive. There are patients who need to take the medicine in fifth or sixth or seventh cup. Okay. There are patients who need to take medicine in fifth and sixth and seventh cup. Okay. So we are now have a standardized LM potency to this 100 ml bottle, standardized, and this has been, actually I don't know where in the world it has been standardized, but it has been standardized where else in world have been standardized this kind of LM potency, but it has been standardized in NIH. So we are calling it NIH method. Teachers there used to prescribe these kind of, and teachers there who have popularized this method of LM potency using in daily clinical practice. And this LM potency is very safe for the beginner to use. Okay, but sometimes it will be very difficult to make your patient understand that itna medicine kyun phek raha hai. That is a different issue with the beginner. But very safe in what, which sense? In centesimal, you cannot change frequently. You cannot change, switch medicines from one medicine to another medicine. You cannot easily switch. And in centesimal, you have to think of inimical relation. But in LM potency, these inimical relations are also sometimes overruled. Okay, if there is any inimical relation, there will be very mild. So there is no need of thinking of switching of medicines, no need of thinking of repetition. You can repeat it over and over again. So it is quite safe for the beginner to use LM potency. And this method, that like 100 ml, what Hahnemann is telling of made by from the beginning. Read this footnote. I'm reading this. Made 40 to 30 or 8-15 tablespoon full of water with additional of some alcohol or piece of charcoal in order to preserve it. That if you are not using rectified spirit, you can use piece of charcoal, but piece of charcoal. So we have standardized to this 100 ml bottle. Leave that 40 or 30, whatever the method of preparation of that solution is given. But we have standardized to 100 ml and 16 dose. One single globule, 100 ml of distilled water, one single globule, 10, number 10 size. Okay, one single globule with few drop of RS, and 16 doses are 16 doses have been prepared. Okay, now patient will take from this, like after giving succussion, half cup of water. Okay, we will ask our patient to take half cup of water and stir it well. Then from there, 1 teaspoon full of medicine will be taken. Okay, so this is first cup. And what is second cup? There will be, I hope you are getting it. There will be this is third cup. First cup, second cup, third cup. Medicine in this, यहाँ से फिर ले लिया. अगर second cup में देना है, if patient is complaining of aggravation, you have to do like this. यहाँ से एक चम्मच निकाल के इसमें डाला, यहाँ से मिला के फिर एक चम्मच दिया. अगर still patient is complaining of aggravation, so यहाँ से एक चम्मच निकाल के यहाँ डाला और फिर दिया. ठीक है. So this is third cup. Fourth cup, I have seen patient is taking from medicine from 50th cup, but for that patient have to believe, have to have faith on you. Okay, I have seen with one of my teacher, that patient was taking from 50th cup, medicine from 50th cup, and he was okay. So why it is happening and how medicines are working, how medicines are working in this type is this method. That's none of my business. Whose business is this? This is a scientist business. If you want to get how medicine is working, stop homeopathic practice and go and have some research. But if you want to practice as a physician, it is enough to know that yes, this is working. Okay, everything you have to explain, that is not your business. You are a physician and you know by your experience that these medicines are working. If it is not in your experience, have some experience and search out that if whether it is working or not. बस यहाँ पे तुम्हारा काम खत्म. इसके आगे काम किसका है? What is who have to prove this? Science have to prove this. We don't have to prove this to others. We just have to show that this is working. Okay, we have just to show that there is gravity. Who will prove that there is gravity? Science will prove. Okay, like that. We have to show that this is working. How it is working, we don't know. Okay, this is enough for us that this method is working. So for sensitive patients, we are increasing cup, but there is a hack. If you don't want to increase your cup, if you can't make your patient understand that increase cup, so there is a hack. Hack is that give the medicine in olfaction for sensitive patient, and how to prepare that olfaction, that is also have been standardized at NIH. I don't know where in else in world this have been developed, but this has standardized in NIH. Teachers there have standardized this. So this is 10 ml vial. This is 10 ml vial. 1 ml of water, at least 0.5 ml of water or 1 ml of water, single globule of LM potency, or if you are not means in initial days I was giving at least 5 to 10 globules. Single globule में क्या होगा, हम 5 से 10 globule मिलाया इसमें, ठीक है. For your materialistic mind, we have to give some more globules. Single globule of LM potency. Okay, you must need to see the LM potency. So this is a vial of, let me show you. This is a vial of LM potency. See, these are globules, so minute. Number 10, which medicine it is? It is dysentery compound. Okay, so this single globule of this from this vial, single globule plus few drops, or you can water, then 8 ml of rectified spirit. Okay, and close it. Then ask your patient to succus it. Wait a minute. Ask your patient to give it succussion. Okay, 1, 2, 3, 4, 5, like this, and then olfaction in both the nose. Okay, if the nose is closed, even then olfaction will be working. Okay, if he cannot olfact with nose, ask to olfact with mouth. Take the vapors by mouth, it will work. Okay, so how it is working, we don't know. So there is a hack. If you don't want to increase the cup, give those sensitive patients medicines in olfaction, and medicines in olfactions are working wonders in my clinic. Okay, you will be doubting that, your patient will be doubting that how these medicines are working, but these medicines are working. Next, in which kind of patient olfaction will work more easily? Those who are highly intellectual, doing mental work. Okay, I don't know how many patients of ignitia of that character I have prescribed. Ignitia is my most researched medicine, and I have prescribed ignitia from 30 to LM potency in different form. I don't know how many form I have, because in my clinic I have I don't know why the patients are coming like that. So ignitia from the very beginning, I have most experienced So most varied doses of ignitia I have experienced with. Okay, in LM potency, in large doses of LM potency, in olfaction, in 30, in 10m, in 1m, like that. So all the doses I am getting with that medicine. There are some other medicines also where I have so vast variety of doses using. One method of giving your LM potency is large dose. Okay, what is large dose of LM potency? That too have been standardized at NIH. That what is large dose of LM potency? Large dose. Anyone? Anyone? Go to 282 footnote, 6th edition.
Two 82 footnotes, sir.
Yes, 6th edition footnote.
Okay. The rule to commence the homeopathic treatment of chronic diseases with the smallest possible dosage and only gradually to augment them is subject to a notable exception in the treatment of three
Underline
great
this.
miasms.
Underline this. Smallest possible. Now subject to notable exception. Where this is exception? This is the exception. Underline notable exception. Read next.
In the treatment of three grade miasm, while they still efflorescence on the skin, that is recently erupted itch, the other on the sexual organ, labia, mouth or lips, and so forth, and the fig warts, these not only tolerate but indeed require from the very beginning large doses of their specific remedies of ever higher and higher degree of dynamization daily, possibly also several times daily. If this course be pursued, there is no danger to be feared as
So primary manifestation of all miasms, primary manifestations of all miasms should be treated with the large dose. And what is large dose? Tell me, what is large dose in LM potency? What is large dose in LM potency? To take the half cup of water में से एक चम्मच लेते थे ना, that is small dose, but पूरा half cup of water ले लिया, that is large dose. Okay?
okay.
To take the
Yes.
whole mouthful, this is whole mouthful of the patient is actually the large dose. Okay? And if not to confuse your patient, तो half cup of water, चाय की कप, किसी किसी की चाय की कप बड़े बड़ी भी होती है, तो 50 ml water, 50 almost 50 ml of water. Okay, half cup of water, उसको पूरा पी लेना है, that is large dose. Okay, so primary symptoms of every miasm should be treated with large doses. And when large doses are given where the susceptibility of the patient is very low. Okay, that is, I am telling by my experience only. I don't get it in literature that where the susceptibility of patient is very low, you have to give large doses. But from my experience, I have given patient large doses where the susceptibility is very low. So large doses of medicines are given. Okay. So this is regarding the LM potency application. Okay, we will read it again somewhat. We'll touch it again when we will come to that discussion. Okay, it was better to finish it here only, but I think some parts should be remaining to discuss later on. From next class onward, we will discuss when there are two difficulties Hanneman have discussed in organon when there is medicines, number of medicines are less. That is first difficulty, and other difficulty 172 onward शुरू होता है. That is when the number of symptoms are less. What you are matching, you are actually matching the symptoms of disease, symptoms of medicine. You are matching this. Okay. If the number of symptoms are less, you cannot match. A homeopath is handicapped without symptoms. Okay. So when there is too few symptoms are present, one-sided disease, how to treat those, and where there is too few medicines are present. But nowadays that difficulty has been solved by a number of medicine. More than 5,000 or 6,000 medicines are available to your disposal. But again, number of medicines are coming from where? Less coming from where? From our study. We don't know many medicines. So again, there is less number of medicine. When you don't know many medicines, how to proceed in those cases? Number one solution will be that buy a software and fed the symptom to the software and fetch the medicine. Okay, that is what Bombay school is doing. But in Calcutta school, we mostly focus on concomitant, on uncommon peculiar symptoms, and try to search the medicine and confirm by repertory, maybe not confirm by Metria Medica, maybe getting hint from the repertory. Okay, getting hint from the repertory is okay, but making the whole process a mechanical one is not a good practice. But people are getting result with that also. But for that also, you need to have a proper knowledge of case taking, because if you are getting symptoms which are not perfect, or which you are cannot interpret it, then you cannot get a good result with the repertory software. Okay, so number one difficulty is when you know little number of medicine. Okay, when you have very few number of medicine at your disposal, how to progress in those cases. Okay, from 162 we will proceed. Any question you are having?
Sir,
Any question?
sir, what will be the large dose in centesimal then?
Large dose of centesimal is not needed. Large dose of centesimal is not needed. That large dose কথাটা বলাই হয়েছে ওখানে এলএম পোটেন্সির জন্য।
Okay.
6th edition footnote তো
Okay.
নাকি 5th edition ছিল দেখো আবার।
হ্যাঁ স্যার 6th এডিশনেই আছে। Okay, thank you sir.
Thank you. Thank you for giving your attention. We will meet in next class.
Thank you, sir.
Thank you, sir. Thank you, sir.
You're most welcome.